In this first lecture on nervous system drugs, we will cover the anticonvulsant drugs most commonly used in veterinary medicine, including what seizure conditions each is used to treat, their mechanisms of action, and potential side effects of the drugs. Homework questions associated with this lecture can be found in the online homework quiz for the nervous system drugs unit. First and foremost, it is important to note that anticonvulsant drugs do not completely eliminate the occurrence of seizures in our patients. They only decrease the severity of the seizure episodes and the frequency of the seizure episodes to make the seizures more manageable. This is an important point for owners to understand when we are prescribing anticonvulsant drugs. Depending on the cause, these drugs are not there to cure seizures. The pet may still seize even when they're on medications, so we have to make sure that we are telling this to owners and warning them. Otherwise, the first time the pet has another seizure on meds, the owners will call all upset because the drugs, quote, aren't working. So we need to make sure that they have the understanding there when we send things home of the expectations of what the medication is actually going to do. Seizures can be the result of a variety of different causes, including epilepsy, which occurs due to a disorder of the nervous tissue in the brain and is seen more in younger animals. Can occur from trauma, usually trauma to the head, surprise, surprise. Can happen from anything like a hit by a car or hit by other things, FedEx truck, whatever. Big dog, little dog incidences, or even, unfortunately, abuse is a fairly common reason we see trauma cases. Ingestion of certain substances can be toxic to the nervous system and cause seizures. Certain types of rodent baits will do this. Ingestion of milkweed plants, certain flea and tick preventatives containing pyrethrins, if used in the wrong species, can potentially cause seizures in the patient. Drug administration or ingestion can also be a cause for seizures. Accidental ingestion of human medication, if the dog gets into human meds at home, is a possibility, or even just regular drug administration. Giving pre-anesthetic drugs, especially if they include things like acepromazine, can result in a seizure episode in clinic. Sometimes they just happen. Certain animals are more sensitive to things. We never really know why, but it can happen. You give a patient a pre-anesthetic cocktail, and next thing you know, they're seizing. So it can happen for any reasons. Neoplasia, remember this is our fancy schmancy medical term for cancer, is a common cause of seizures in older animals. Can be the result of a primary tumor in the brain tissue or secondary metastasis to the brain from tumors elsewhere in the body. Metabolic seizures occur as a result of other disease processes occurring in the body. For example, heat stroke can cause a metabolic seizure. Liver disease can cause metabolic seizures due to buildup of toxic materials in the blood that the liver is not processing anymore. Things like hypoglycemia, low blood sugar, can cause seizures, and a lot of other metabolic causes are in there as well. Infectious causes can be from bacterial infections, like bacterial meningitis or bacterial meningoencephalitis. We can have viral causes for seizures. Canine distemper virus can cause seizures. Feline panleukopenia virus can cause seizures. And we can have fungal causes for seizures. So if fungal organisms like blastomycosis get into the brain causing fungal meningitis, it's awful, and that is definitely a potential cause for seizures. Finally, we can have idiopathic seizures, which basically is just a fancy medical way of saying, I have no freaking clue why your pet is seizing. Of course, we'll make it sound nicer, but that's basically what it means. We've looked at all the other things, and there's no other reason. So for all of these causes, while the anticonvulsant drugs are used initially to control or stop the seizures from all of these causes, if things come in seizing, we're going to do something about it. Not all of the causes require long-term anticonvulsant therapy. For things like trauma, toxins and drugs, metabolic causes, and infectious causes, the underlying cause must be addressed, of course, and the animal must be stabilized. If the initial inciting factor can be addressed and treated, it may, quote-unquote, cure the seizures, and then the patient will not have to be on long-term medications. So if the dog had a seizure due to a drug reaction, okay, we just make sure we clear the drug from their system, put a note in the chart, don't give that drug again. We might not have to treat long-term. Things like that. Other things, epilepsy, neoplasia, stuff like that, they might have to be on seizure drugs long-term. So that'll kind of be the focus of the rest of this lecture, is those cases that do require long-term seizure treatment. Things like epilepsy again, and here are the drugs we can use to treat all of that.